What I really want to do, first of all, welcome to our first training call that we're doing here as a healthcare team. Last year, just to kind of give you guys some scope, we had about 20 agents or so, a little bit more, over the course of the year, right? A little over $1 million worth of premium on the health side. So super excited about that. We figure we can easily, 5x that this year. So some of you guys have written some products before, some of you haven't. Either way, this call is going to be super simple. I'm just going to kind of lay out what the initiative that we have going on and kind of give it some context. And then after today, we'll have a weekly call at the same time, same place, and we'll get into the details of each particular segment that we do, right? So whether it's Medicare, healthcare, ancillary, whatever your cup of tea is, okay? But today I just kind of wanted to give some scope to the project and like kind of here's where the bodies are buried, so to speak, right? And here are the here are the levers you can pull to add some cash flow into your business and some value for your clients. So what I'll do is let me see if I can share my screen here. So can you guys see my browser? No?
I see it.
You see it? All right, cool. I'll turn off my video too, just in case that's adding to the situation, but everybody can see it now? Okay, perfect. So Sean approached me now, I guess, last October, 2 Octobers ago, and asked me to put this together for FFL. So, the context of it is basically we had a bunch of people not doing any kind of healthcare at all, right? So you got like 20,000 agents or so that are out there talking about life insurance with their clients. All these clients have health insurance needs that are being taken care of by other people. And so it's just kind of silly. If you have a license, why not use it? Why not serve your clients, right? Number one. Number two, we had some agents who were doing it, but were being forced to do it under, through a different brokerage for whatever reason. And so that just doesn't make any sense either. So if we're going to do it, might as well do it in-house, right? And so this is the official FFL healthcare product line. And so it's the same lined up the same way that the rest of FFL is, right? So like you're contracted directly with the carriers, get paid directly from the carriers. You're non-captive. You can do as much with us as you want, as much somewhere else as you want. It's basically but the cool thing about it is that we've tried to make it to where the street agent, the writing agent, has a higher out of the gate commission than, anywhere else that I've seen offering, number one. And number two, that you own your book of business. So it belongs to you. It's written through you. You're not getting paid from FFL. You get paid from the carriers, right? So that, if you whatever business that you write here or somewhere else, you own it. And then the third thing is that it counts for production, right? So that's another big thing. So like last year, that $1 million or so worth of premium that we wrote, that was added to people's Hall of Fame counts, which is really cool. So like if that's something that's important to you, this is all the premium that you write through this, also counts for your red jacket and whatnot. So whenever we put it together, initially the idea was just to do Medicare. But once we started tackling that, we realized all these conversations basically dovetailed together. And so we wanted to make a resource where it was, any kind of healthcare issues for any client, we could address it. Okay. So basically here are the product lines that we do, right? So we've got Medigap, which is Medicare supplement, right? I guess the new popular name for it is Medigap. Maybe that's an old name coming back. I don't know. Skylar, you can speak more to that, but Medigap is the preferred nomenclature now. So Medicare Advantage, which is the hot ticket right now, especially in like urban areas and whatnot. Like everybody's wanting to do that. If you're in a good network spot, Medicare Advantage, we support that. We support health insurance. So that's whether it's ACA, Affordable Care Act, otherwise known as Obamacare, right? Whether it's short-term health, maybe you love the idea of the ACA, maybe you hate it, whatever the case may be, whatever your clients think about it, right? We can address everybody. Okay. Dental, vision, and hearing. So this is a very common set of add-ons for people, especially on original Medicare, because original Medicare does not take care of these three things. And so it's almost a must-have for people that want to stay on original Medicare and use a Medigap plan. But they can also be used for families. So, like, if you like working with, let's say, groups of employees, and you want to like help a company like add on to their healthcare plans, adding on a dental, vision, hearing, those are all super popular, right? Prescription drug plans. So again, for Medicare recipients, this is typically people that would buy these would be people that stay on original Medicare, because original Medicare doesn't include prescription drugs, but now it does. And so you buy a standalone PDP is what they call it. We support all those. Hospital indemnity plans. These are plans that pay, instead of paying the doctor, they pay you. They pay the person, right? That's what an indemnity plan does. So it's just like going to a restaurant, and in the restaurant, like, let's say I'm eating dinner, they're going to give me a menu, and I'm going to order an appetizer and an entree and a soup and a salad and a dessert and whatever. They're going to add up all the things that I bought, and they're going to give me a tab, right? They say, okay, this is your bill, la cuenta, right? And that's the same thing that an indemnity plan does, but in reverse, right? So, I broke my arm, I rode an ambulance, had a cast set, needed stitches, went back for 3 checkups, whatever the case may be. All those things add up. They all have dollar amounts attached to them, and then the plan adds up and pays you directly. So, and we've got hospital indemnity plans from Aflac, Allstate, Cigna, all the big names. So, like, if people want this, we have it. We have good comp with it. And then ancillary products. That's things like, hospital indemnity is an ancillary product, but it's kind of a standalone thing. A lot of business owners will use it, for example, to offset their out-of-pocket costs. Kind of makes it like a poor man's disability, hospital indemnity type things. Ancillary products is just a bucket that includes everything from like any plan that's an add-on to your healthcare. So you guys, I'm sure, know about cancer insurance. So FFL has always had like a cancer policy, say with Mutual of Omaha, that you can write. Now you have access to a bunch of other carriers. So again, Aflac, Cigna, Allstate, cancer plans, heart plans, stroke plans, critical illness. These are the kind of plans that will like list like 19 different, things. If any of these bad things happen to you, they'll cut you a check, right? You can set these up to be either a lump sum, somebody gets diagnosed with cancer and they get a check, right? Or you can set it up to be a treatment plan where it's like, okay, yeah, you get a check, but then every time you go radiation or chemo, you get a check. Every time you get a pap smear or mammogram, you get a wellness deposit, right? All these different ways you can set these up, you now have access to. Pardon me. And then we also do the certification for all this stuff. So some of you guys may already be familiar with, some of these product lines, or, oh man, I used to sell that in my past life. That'd be great to get that again. I've heard that a bunch of times, or others of you might be like, dude, this is all Greek to me, but it sounds awesome, right? How do I get started? So we do all the certifications. So the first thing that we are kind of recommending people do, and again, this is if you go to ffl.health, not .com, but ffl.health. This is the website. If the very first thing, if you're kind of like exploring this and you really don't know anything, and this is kind of like where I was when I first started learning about, Medicare and healthcare. I'm like, I don't know, man. The doctor's a place that you don't go, that's the way I was raised. You didn't go to the doctor, you just nutted it out. But once I started getting educated, I'm like, man, these are some really cool. So we have a 101 learning center where you can go through and basically, what is Medicare? What is healthcare? How does it work? Right? Who's eligible? What are the What are the dates when I can sign up? All these different things, a bunch of different rules around healthcare products that don't exist around life insurance. And I think the biggest reason for that is, life insurance is a nice to have, right? You could argue it's a need to have, but it's a nice to have. Nobody's going to throw you in jail if you don't have it. And when it becomes a problem is, after you're dead, right? So some people kind of just put it I'll address that when and if I have time for it, right? But health insurance is a need to have, right? So you're not under you don't have control over when you need to access the healthcare system. And as you age, I'm learning this the hard way, right? So I'm going to turn 49 here in a couple months, and my body's starting to break down, right? That's recuperated stuff. When you get into your 60s and 70s and 80s, you're using the healthcare system a lot more than you were, let's say, when you were in your 20s or 30s. So because it's a need to have, there's certain regulations around how you can get it and when you can get it and who's eligible and who's not, and thankfully there's a lot of government programs out there to supplement or take care of the cost of these healthcare programs. As a result, as an agent, sometimes you're selling a product that you really are collecting no money for, that the client never even pays for. You're just helping them get access to services that they already qualify for, right? And so how can you learn all that? You can learn that in this, start on this Medicare 101. And then as we go through these trainings over the next few weeks, we're going to break that down into more detail on each segment. So that's the first thing, is I would start here. If you don't really know anything about anything, you're just trying to figure things out. If you know what direction you want to go, and so let's say, and I've had a couple of conversations like this with people. So if you've already gotten your feet into some of these markets, obviously just do what you already know how to do, right? Like, we'd love to have your business on our platform. We think you get paid more money. You'll have more control over your business. It'll all count for your overall, targets that you're going for the year. So if you're ready to do that, then you can just hit the get contracted button here at the top and request contracting, right? But if you're trying to figure out, like, okay, how would I fit this into my business? The advice that I usually am giving people, that we're usually giving people, is to focus on Medigap plans and your hospital indemnity plans, ancillary products. Okay. The reason for that, and then this is if you're brand new and you're just starting to use your health license. Okay. This is my recommendation. So the reason for this is, number one, you don't need any special certifications to do those things. Okay. If you have a health license, you're good to go, and you can rep those products. Okay. Number two, they are right alongside the products that you're already talking to your clients about. Okay. So if you're selling final expense, for example, you're buying leads from the ILC or wherever you're getting your leads, and you're sitting down with people, veteran leads, whatever it is that you're running, you're talking to seniors, right? Most of the time, that need these final expense plans. They also are dealing with Medicare. Okay. So there's no rule against cross-selling or mentioning, Medicare supplement, right, alongside a life conversation. No rule whatsoever. Okay. There's no rule against, having a conversation around a cancer policy or a heart policy alongside a life sale. Like, these are totally wide open areas that are easy to play in. And you can literally, like, just cross that bridge with like a real quick sentence transition, like, hey, Martha, do you feel like I gave you good service today? Did I help you? Yeah, I really did. Well, that's awesome. Well, hey, listen, one more thing before we hang up the phone. I noticed earlier you were talking about your mom who had gone through cancer, and you said that was breast cancer, right? Okay. So have you ever thought about, like, what would happen in your situation if you were to go through cancer? Like, if you got diagnosed with cancer and you knew in the next 9, 12, 18 months, you were going to have to deal with treatments and stuff like that, how would that affect your lifestyle at all? Or would it? Right. And that'll get that conversation started around a cancer policy, right? Same thing with a heart policy, right? On the Medicare side, somebody's turning 65 or over 65. It's so easy to just add on at the end of your conversation. Hey, Hunter, do you feel like I gave you good service today? Awesome, man. Awesome. Hey, listen, I noticed on your application that we filed here that you're 68. Do you have a personal Medicare specialist that that helps you get all the benefits you're entitled to, or are you still trying to figure that out on your own? Personal Medicare, but what's that? Oh, well, that's me. Right. So these are real easy, like, crossover things that you can sell, as long as you understand the concepts. And the Medicare 101 that we have on this, and that we'll do over the next couple of weeks, will get you conversing around that. So as long as you can address it, they're the very, very simple products to talk about, to explain, and to write. Okay. Very, very few health questions, when you're writing these things. So that's where I would recommend you get started if you are not started. Okay. If you already are started and you're already writing, say, Medicare or healthcare somewhere else, then just, look at what we've got, and let's see if we can get you, started on our platform, to the best of your, to make the best of your situation. So, I want to kind of take a second and just kind of introduce the team. So we got our team here. So obviously myself, Zach Tradowski, most of you guys know, he and I are, partnering up on all the health stuff for FFL. Paul Suttis on the call here, Skylar Smith, these guys. Skylar is the OG Medicare of Medicare from back in, when did you start working with Sean on Medicare with Andrew?
2016, 2017. So yeah, 2016 with Sean Ruggiero, we started MedSup sales and try to get that going for a little bit. So yeah, it's been around FFL, but just kind of lingering in the background. Yeah.
And you've been here at FFL since what year did you come here?
2015.
2015. Yeah. So yeah, that's cool, man, to have a guy like of Skylar's like, tenure, working with us and stuff, because he's been here since almost the very beginning. He just missed the first year, of FFL. So
yeah, there's only one convention that I haven't been to. That was the first one. So yeah.
That's cool, man. Yeah, that's cool. Wouldn't it be great if you had like just 4 or 5 minutes of video from each one, and you could kind of like chart the evolution through, you can make a cool TikTok video about that.
I may have that, actually.
That would be a cool TikTok video, man. Cody will help you put it together, man. Cody's a TikTok master, dude. Social media master. And then Christina Janizer is on here. I think Christina is she's kind of new to the health game, but she started playing in it last year and just dominated. I mean, picked up over 100 clients in the last couple months of the year, and just really passionate about healthcare and helping people get access to the health system, and so she's awesome. She's on the phone talking about this, 10, 12 hours a day. So like, it's just really cool to have her a part of this, where she can speak to some of the training, like the actual tactics of like, here's what I said yesterday, which is awesome. And then also Neil McMinn, who's out of Orlando. Neil's had some health issues in the family, so couldn't be on here today, but he's been doing Medicare sales for the past 10 years. So knows his way around, a benefit packet. So I wanted to introduce you to that, so you kind of know, who's who and what's what there. The other thing
Don't forget about Paul.
Oh, did I not say Paul? Paul, I'm so sorry, man. So Paul's yeah.
I did wave, but that was about it.
What's that? Did I just skip over you? Dude, I'm so sorry, man. Yeah, Paul Suttis, who's just I can't even use the word I want to use, a baller. There we go. In Virginia, in the Mid-Atlantic, but used to work for a couple of the healthcare carriers, and now has his own Medicare agency in Virginia, and then now is expanding in surrounding states. So we're super lucky to have Paul, because his expertise on Medicare Advantage and like, once you start kind of peeling the onion in this world, you'll learn about this thing called D-SNP, which is dual special eligible. Is for people that have Medicare and Medicaid, and also C-SNP, which is for chronic health conditions. So like, Paul's just an expert on this stuff. He's worked with how long you been doing it, Paul? How many years?
This past AEP was my 17th AEP. The DSNP thing really took off here in Virginia in 2018. And when I was with United at that point, that was the largest United kickoff. We had 33,000 DSNPs sold that first AEP. So the opportunity, especially in states that do not have that market but are about to launch those markets, is enormous. So yeah, I love this stuff. I love having the relationships with those Medicare folks. I'm absolutely pumped and excited to help you guys. But yeah, anytime y'all need me, let me know.
Yeah, I'm fired. For those of you guys that don't quite like, if that's a little over your head with the jargon or whatever, and that's my fault because I said it first. But so it's when the government is taking care of somebody's health care, which is what's happening in a DSNP, right? So the government has them on Medicaid, and then they're also on Medicare, but the government's paying for that, right? That population is, for whatever reason, they don't have the same access to information or think about accessing information the same way that, say, we might on this call. Like if I need to know something, I go to Google. If I can't figure it out, I ask my AI bot, right? If I can't figure that out, then I start working my network, right? Like who do I go to church with, or et cetera, that can help me figure this out, right? And just the average person in this population, like that would qualify for, somebody in a lower income situation, they don't, for whatever reason, like even though they have all these resources available to them, half the time they just don't know. And so what Paul's able to bring to the table, and what we're able to bring to the table for our clients is to really educate them on, hey, here's what's it's already in place for you. You just have to like sign up here, tune in here, check this box, get this paper filed, whatever the case may be. So am I oversimplifying that, Paul?
Yes and no, if that's an answer.
Yeah, that's an answer. That works. So, but we'll get all into that stuff like on a following call, right? So today I just kind of wanted to give you guys kind of the lay of the land. The other thing that I wanted to kind of point out to you guys, if you didn't already know, is who our integrity partners are, right? So we are working with Elder Care as our integrity partner. So they were the seventh acquisition by Integrity. So like I think they have over 200 partners now. I don't know what the exact number is, 200 and something. So they were number 7, and they've been doing Medicare. The reason I chose these guys to work with, so like Integrity has all these Medicare partners, and they're all awesome. Okay, so Agent Pipeline, Premier, all this, we can go down a whole list, right? They're all great. They all have their own angles, but the reason I really liked Elder Care after having conversations with everybody is they're really like, it's the reason that actors love working with Clint Eastwood, because they say, well, shoot, Clint Eastwood, like he's one of the best directors for actors in Hollywood because he's been an actor for so long. He's been in so many different types of genres of pictures that he just kind of gets like what the actor's going through. So like he's super easy to work with if I'm an actor, right? The same thing with these Elder Care guys. So I mean, Jeremy, Roger, all these guys that work there that have run the company, they started in the field selling back in the like the 80s. That's what some of these guys were doing. And so, and now, like, I mean, Jeremy runs the whole company. I mean, he was in the field like not even like 5-6 years ago, like selling Medicare. So like, I mean, these guys, they have the agent at the heart of what they do, in a way that I felt was just a cut above. And so that's why I wanted to work with them. What's cool about the way we have it set up is, all the volume that we do with Elder Care on this health and Medicare side, it gets credited towards FFL. And so it's internally Integrity kind of does a thing with the numbers and everything. And so we get the full benefit of working directly with Elder Care, and all the premium and commissions, et cetera, count towards, FFL's books, which is That's just a win-win-win for everyone, because we get like real expertise from real people that know what they're doing, that real team that knows what they're doing all up and down the line. So they elder care is cool too, because they have multiple different training opportunities. So like every week they have, you can go to eldercarebroker.com and kind of scope out their site, right? But they have literally every product that you would want. And then ones they don't have, we use the integrity relationship to get that. And so, every now and then I've had an agent come to me and say, hey, well, I'm in West Virginia and I need access to this one carrier. And it's, I think, I can't remember who did. I think Paul was the one that brought me the last weird one, when I was like, I've never even heard of these people. They're in like 2 states, but it's all right. Right. So we got it. So that's the power of that relationship. What the other thing that's cool is, so with Medicare and healthcare in general, you can't work off of a rate sheet as much as you can in the life business. Like in the life business, I can go to insurance toolkits. Like, I'm sure you guys all know, like, you go to insurance toolkits, pay my $30 a month, and I get all the quotes, right? I say, here's what my client has. And they say, okay, here's the best policy for you, right? Well, on the Medicare side and the healthcare side, we have this thing called Medicare Center that Integrity has built, and they pay for all of the agents. Okay. So once you have your first health contract through FFL Health, that'll be on the Integrity platform, right? So it's not FFL Corporate's a separate thing, right? The Integrity platform gets you access to this. So once your NPN is registered as a Integrity agent, right, you get access to Medicare Center. Inside Medicare Center is an app called, there's multiple apps in here, all of which typically you have to pay for on the outside, but we get them for free. Okay. So Sunfire is one that some of you guys may have heard of, right? So that's built into Medicare Center for free. Connecture is another one that's out there, that's really big out there as a quoting tool, that's built into Medicare Center for free. CSG Actuarial is huge on the Medicare supplement side. So that's built into here for free. So I'll give you guys another tool here and we'll go into more depth on these over upcoming calls. But this is a website that you can save on your phone, and it's T65.app. So you'll see this terminology out there quite a bit. T65, it just means turning 65, right? So when somebody's turning 65, they become Medicare eligible. The industry term is, T65. So, hey, I need a T65 list, is like a list of everybody who's turning 65 in this particular zip code or county or whatever. Okay. When you save this on your phone, obviously, like it'll be squished a little bit. It'll look more like this, right? Here I can do that. So give you the more phone experience, right? And you can save this on your home screen of your phone. It gives you access to real quick med sup and final expense rates that you can quote. So like, for example, like all you need to quote a med sup is like what zip code they're in, what plan level that they're trying to apply for, their gender, what age they are, and whether they smoke or not. Once you know that, then you hit C rates, and this pings CSG Actuarial's database. So it's updated in real time, and it'll show exactly like what the best deal is for that person in that zip code. And that's all something that's powered through CSG Actuarial. You have access to it through Medicare Center. So here's like the pricing, right? So like somebody was asking me the other day, well, hey, I have Mutual of Omaha MedSup, which is awesome, by the way, right? Why do I need other ones? Well, you don't necessarily, unless you want to give the most competitive pricing, to your clients, So sometimes that is Mutual of Omaha, sometimes it's not. So here's Mutual of Omaha, it's $113, right? You can get it down to 100 with their household discount, 12% it says here, right? So, but you can see the price goes all the way down to 88, 80, $90. So what happens a lot of times is people, and this is the power of being able to help people with even just a Medicare supplement. I'll show you guys something. So let's say I'm talking to somebody who's 68, okay, same situation. And I help her with her final expense. Okay. And then I ask her, hey, Margaret, how are you fixed up for Medicare? You getting all the benefits you're entitled to? Like, you have somebody helping you do that. And let's say well, I don't know. I've got whatever. Here's what happens with people. When people turn 65, they're guaranteed coverage, right? They cannot be turned down. There is no underwriting. Okay. So a lot of times people will gravitate towards like the bigger and best names that they are familiar with, right? And so those plans, they get a lot of like incoming, people turning 65, right? And so they, but they can't check them for health. So now what happens over the next few years is those people start using the system, right? The sick ones that they all took in, that they had to, right? Start using the system. As they start using the system, they make claims. They make claims, right? Because of the premium they have to manage that, right? So you could be talking to somebody who's on, a Heartland plan or, Cigna plan, Washington National plan, who's paying 200, sometimes over $200 a month, right? This is for a plan G, right? And depending on what their situation is, I mean, you can save them a ton of money. This is the exact same benefits, right? Exact same plan, right? It's just underwritten by a different carrier who didn't have to deal with the influx of people of that age that particular year, whatever that case may be, right? And so it is, and what's great is like let's say you're able to save somebody $80 a month, for the exact same benefits, right? So they have a plan G that they love through Aetna, and I'm going to switch them to, Allstate. I'm going to save them $80, right? Instead of saving them $80, what if I saved them $20, which is still a lot of money, but I included, right, a cancer plan, a heart plan, a hospital indemnity plan, right? So, hey, not only, Margaret, can I save you $20 a month and keep your benefits exactly the same, but I can also add in at that price point all these extra benefits that you don't have right now. Like if I could show you how to do that, would you be interested in learning how that works? Well, hell yeah, I would be, right? So that's how that's the cool, and you're not selling with premium at that point. You're not trying to make a case for why they should set aside this extra money, do what's right for their family. I mean, you're putting money in their pocket and giving them more benefits. It's a absolute no-brainer, right? So sometimes even people that you can't or don't make the sale with for life insurance, you can still help them out with the Medicare stuff and make their situation better. And now they actually have more money to actually spend on more life insurance. So if that makes sense to you guys. Yes, ma'am. Go ahead.
Yeah, that sounds amazing. Just from my little bit of experience when it comes to like Medicare and things like that, there is some factor as far as which carrier they go with, based on their providers being in network. Is that still the case here? Because like they might be with Cigna because that's the carrier that their provider or doctors are contracted with, right?
Yeah. So, and you're and it's Patrika, right?
Yes.
Yeah. Hey, Patrika. So yeah, you're thinking of healthcare the exact same way that we all think of healthcare, right? Because we're all under 65 on this call for the most part, right? So the way we access healthcare is I look at my healthcare card and I go, oh, that's United, so I can go to these doctors, right? So that's the way Medicare Advantage works. Okay. So if I'm a senior and I get on Medicare Advantage, then yes, right? So I'm with Cigna. I've got to go to see Cigna doctors. I got to stay in network. If I don't, I'm gonna have higher copays and deductibles. Same thing we're all used to. Okay. What I'm talking about here is original Medicare, like people that, which by the way, and I don't know what the current up to the month stats is, but it's roughly 50-50 out there in the country. Half the people have Medicare supplement, half the people have Medicare Advantage, right? Some of the people have Medicare Advantage wish they still had original Medicare. Some of the people have original Medicare, want to switch to Medicare Advantage. So there's always some churn there. It's like the Atlantic and Pacific Oceans bumping up against each other, right? So with original Medicare, which is what I'm talking about here, there is no network. Okay. If you're a doctor and you accept Medicare, then you're a part of Medicare, right? If I'm a senior and I have an original Medicare card, it doesn't, I mean, I can walk into any doctor. I don't need a referral. There's no network. 99% of the doctors in the country accept Medicare. And if I accept Medicare as a doctor or a hospital, then that senior can walk in there and they are part of the network because they're part of Medicare. Medicare is that network is 99% of all doctors. Does that make sense?
Yes, thank you so much. Thank you.
Yeah. Yeah. It's super cool. In fact, when I started learning about it, I was that's the first time I got excited to get older. I was like, oh man, this is great. Can't believe we do this for these people.
Right.
Anyway, yeah. That's good question. So I wanted to give you guys an idea of some of these tools that are available because since we're part of Integrity, since we're working with elder care, since we have access to a lot of things that other agents don't have access to, right? One of the other things we get is we get a personal website. So, and this is through, oops, I need to clean that link up. So through kind of like Ethos, right? How Ethos will give you a portal and people can go there and quote themselves and buy insurance and you make a commission. It's the same exact thing on the Medicare side, right? So you get a website and it says it's on Plan and Roll. So for those of you guys that don't know that website, I'll show it to you real quick. This is another Integrity property. So planandroll.com, they spend a ton of money advertising this around the internet. It's like one of the most visited sites for seniors, but this is an Integrity website. And by the way, it's great for you if you're just trying to learn about Medicare and expose yourself to what's out there. It'll go through here and introduce you to Medicare. What is it about, et cetera. What are the basics, right? Who's eligible, whatnot. This is a great site to just go through on your own if you're like a self-studier. I know not everybody is, but for those of you guys that are, this is a really good way to bone up on your knowledge really fast. But you'll get a portal on here, a website. It's like a long tail website that people can go to, quote themselves, and apply and ask for coverage without ever even having to deal with you, and you make the full commission on it. So it's very, very, very cool on here. And I'm trying to think what else I wanted to cover today. I think that's most of what I wanted to cover today, is just kind of give you guys some context of, what we're doing, what we have, and what we're excited to roll out. Let me look and see if there's any questions here. I know Paul's been pretty active on the chat line here.
I think I've covered them all.
Yeah. Yep. Looks good. Thank you, Paul. And also to give you guys, some context to like the different members of the team and how they're going to be helping you. The way we have this worked out is, there's there's not like a separate team. I get that question all the time. Oh, do I have to make any switches in my FFL hierarchy or whatever to take advantage of this? No. Okay. So the way Sean has this rolled out is it's optional for everybody, but it's available for everybody and everybody's encouraged to do it. So some of your uplines are excited about this and they have gotten contracted, and there's room in their downline to put you in their downline and get you set up to sell health. And you'll come to all our trainings, but they'll get paid, you'll get paid, the company gets paid, everybody gets paid, right? So I know some people are overly concerned about where the money's going, and it is a business. I get it. So that's there. Okay. Now some uplines also have decided, I'm not interested in that. I don't want to learn it. I don't care. It's not my bit. Whatever my people want to do is fine, but I'm not getting involved. Okay. For people that are in those agencies, that's fine. Just either way, you come to us and get contracted. Okay. So if your upline is participating, when we contract you, we will contract you under that upline. If they're not participating, we'll contract you directly and we'll save them a spot, right? Whenever they decide to hop on board, right? There'll be room for them, right? So we have it set up to where it's fair and available for everybody. And so don't feel like, oh, well, I wish I could, but my team's not really embracing this. they don't have to. Okay, so it's for the individual agents that want to embrace it. It's here for you to hop on, and please pass the word. Tell your friends, whatever you got to do, right? So, anything else, Skylar and Paul, that you guys wanted to, and Christina, that you guys wanted to chime in with at all before we wrap today?
No, that was a great overview of everything, Eric. So we appreciate that. Thank you for doing that. I think at this point, we're just going to kind of, as these trainings go on, get more into the nitty gritty on each individual category that we do. So fantastic overview. I don't have anything I need to chime in on for today. So yeah, again, thank you.
Okay, good. Paul?
Copy exactly what Skylar said.
Okay, sweet. Christina, you on here? You got anything to add?
No, she can't talk right now, but yeah, good job, man. Yeah, everything was good.
I have a question, Eric.
Go for it.
The AHIP and the FFN, that's on us, right? We have to take the time and the investment to get those certifications, right?
Correct.
Okay.
Yep. So with the AHIP, we do have a discount through Aetna. Most everybody on here is, I think, contracted with Aetna. So Aetna has, if your NPN is registered with Aetna, you can use the link on our site and go register for the AHIP. It's usually $175, $50 off, $125, right? And it's now, you also, if that's an issue for you, or that it's, and I totally get it, everybody's in a different spot, right? What's nice about the AHIP is, if you can afford it and set aside the time, it is a transferable test. So like when you pass the AHIP, and there's another one called NABIP, NABIP, which is only $100. It's accepted by fewer carriers though. Okay, so just understand, like AHIP is accepted by almost all the carriers. In other words, you don't have to certify 100% with all the other carriers. You can say, hey, I already passed AHIP, and then they'll just give you this tiny little piece to certify on, right? For Aetna's products, let's say, or Cigna's products, or United's products, exactly like what Patricia was asking, right? So Patricia is asking, hey, don't I have to understand about their company's network? Yes, you do. And because United might be amazing in California and Texas, but it might be terrible in Illinois, for example. Like you don't know until you figure out, like, each plan's a little different. Which is why, by the way, if you're not wanting to overburden yourself with details, staying on the Medicare supplement or Medigap side of things is so nice, because, dude, it's Medicare. It's every state, every doctor, super easy, right? So, but if you're getting into Medicare Advantage, then you need to understand the different networks and things that they do. So AHIP will grandfather you in with almost every carrier. NABIP a bit fewer. So you want to just Google that and check, like, hey, which ones do I want to represent my state? And does NABIP cover it? In which case, that's only $100, right? So you save yourself a little bit of money. The other way to save yourself a little bit of money is you don't have to buy either one of those. Every carrier offers their own full certification. So you can go to United, let's say, if you want to rep United's products, and you can take a full United certification, never take AHIP at all, just take it all, and you'll be certified to sell, and you can sell their Medicare Advantage products. And then you can go to Humana and take their full certification, right? And you'll be certified to sell. Humana doesn't do that? I know you. Okay. Well, I know United, Aetna, a bunch of the other ones do. So
United does. Paul, at least last year they weren't. Paul, are they doing it too?
Yeah. Pretty much every carrier does that. Humana's was so simple, it was impossible to fail. It was literally just click, click, click. You cannot fail it.
But do you still have to take the AHIP with Humana is the question?
Yes, you do.
Yeah.
Yes, you can. Yeah. So like with United Healthcare, Eric was explaining that you could do only their certifications, which that's unique to United Healthcare. From what you don't have to take an AHIP, right?
Correct.
That's the only carrier.
Well, Aetna too, I'm pretty sure.
If I have a brand new agent that is starting to fail AHIP, right, I tell them to stop before they take their last AHIP and go take their certification with United, so they can at least sell one product throughout the year. Because if they fail AHIP, then they're just stuck without anything. Because if they fail AHIP before they take United, then they're just stuck.
Hmm.
So no, and that's kind of to, I believe it was Miss Lewis's question about, do I need to be contracted and certified? With Medigap, hey, let's just contract you. We don't have to do a bunch of certifications like AHIP. For Medicare Advantage, you do have to take AHIP. So there's
Except for United Healthcare.
Except for United Healthcare, you can bypass AHIP, correct?
Yeah. Yeah, and you may be right, Eric. It could be on Aetna as well. I didn't see that because I always just take the AHIP.
Right, taking
Well,
AHIP.
yeah. If you're gonna be contracted with, it's almost like buying a season pass, to go to Six Flags, right? Like if you're gonna get contracted with more than one carrier, then it's crazy. Why take the same test 3 times? Like just take AHIP and be done with it.
I'd like to chime in that every year you have to recertify with all of the carriers or you can't sell them. So that's something
Correct.
that's pertinent to know for new agents, that every year you're going to have to redo this before open enrollment.
Yes, ma'am, you're correct. And again, that's everything that we're talking about is for Medicare Advantage. Okay, not Medicare Supplement, not Medigap, not cancer policies, not heart policy, right? Just Medicare Advantage has that requirement. Okay. The only other segment that we do that has a requirement is the ACA. So to handle people to sell health insurance on the marketplace, the ACA, under the Affordable Care Act, right? You need your what they call FFM, which is federally facilitated marketplace training. Okay. Leave it to the government to have a ridiculously long whatever. So that is free, and that is on the CMS website. We have a link to it on our front page. So if you say it says click here to get your FFM, you literally go set up an account at CMS and ask for access to the class. You'll get it. You can knock it out in 4 or 5 hours. I will give CMS this. That's actually the most engaging training that I've taken. It's most trainings occur to me as kind of like, I gotta go through. But that training was actually like really interesting. Oh wow! Oh, this is how that works. This is how that works. I felt like I was kind of very educated after I got done with that. So I don't know if anybody else had that experience, but that was not a horrible training. Anyways,
I have a question,
yes,
or just clarification. So I understand you have to recertify for the AHIP, and you mentioned Aetna. I did the AHIP last year. Is it going to be the same price every year to recertify, or is it just like an initial price and then like a renewal price?
no, it's $125 every year.
Okay, all right.
But if you think about it in that way, that's half of one Medicare Advantage application, or less than half of one Medicare Advantage application. So you only need to sell one to pay for that certification. And
Absolutely.
you're trying to sell a whole lot more than one generally.
Right. No, I was just wondering, but no, it's definitely worth it. It's definitely worth it for sure.
Well, I would say it's worth it, Patricia, if you actually want to sell Medicare Advantage, right? So for those of you guys that are kind of on the fence and you're like, I don't really know, don't worry about it. Don't take it. Just focus on having the conversation with people, and then your market. What'll happen is, I don't know y'all's experience, but like my experience was, my clients were asking for it. Right? Like I would help them with their life insurance, or I'd help them with a cancer policy or whatever. And they would say, man, can you help me with my health insurance? Can you help me with my Medicare? I mean, like I would get those questions all the time. And so to me, it was just like, well, I need to learn how to say yes to this question instead of no, because when I say no, it's costing me money. Right. So let me figure out how to say yes. Right. And then as I'm helping people, I realized, because initially I was like, well, I'm not going to fool with AHIP. I'm just, that sounds like a big nightmare to me. I'm just going to focus on Medicare Supplement, Medicare Advantage, and I got or Medicare Supplement, Medigap, right? And I did, and so when it became painful for me to turn away the business, that's when I went and got certified. And that's what I would recommend for all of y'all is not to like there's no reason to buy all these certifications and beef up your product because you think it's a great idea, right? Instead, get educated, and that's what the purpose of these calls are. Get educated on what the stuff does. Get educated on how to ask the questions of your clients and prospects to hear their responses, right? And that's what's nice about this health business. It'll literally fall in your lap, right? Or it'll be banging on your door if you're having the conversation and asking the questions. You're going to discover a ton of opportunities. So, like, our main purpose with these calls is just to really my main objective is to raise your antenna. Just get your antenna up so that you begin to see like the opportunities that are all around you, right? And if we do that, then I'll be very happy with the outcome of this, So
Absolutely. Okay. I'm asking a lot of questions. Sorry, but
you're good.
Before we get off of this this topic, as far as I think Skylar mentioned commissions, right? How does that work, right? Because I've heard different things. Like, so there's some people that are new to Medicare, and so they're just coming in. Are commissions different for that? Or there's some people that we might just switch carriers with. Do they change based on they're brand new to Medicare or transferring from Medicare? How does that work?
Yeah, great question. So look, if you don't have any existing Medicare contracts, then we have a comp grid that we've put together. It's on the website. I'm not going to pull it up right now, but it's on. If you go to FFL.health, hit the contracting button at the top, you'll see the comp grid laid out there on MedSup and Med Advantage. Okay, the Medicare Advantage, I'm just going to apologize. The rates are not updated to this year's rates. Okay, so they're still last year's rates. But so the way it works is for Medicare Advantage, let's just start there. Okay, for Medicare Advantage, we pay 100% of what CMS says the agent's commission should be, right? So if CMS said that year, hey, the agent's commission is $605, right? That's what we pay. Okay, so we don't step in the middle of that. We don't cut it. We're giving you 100% of whatever CMS says. Okay, CMS is the Center for Medicare. That's the government. That's HHS. Okay, so other brokerages that you might work with or could work with or whatever, that's usually where they're making their first cut of money, is by cutting that. You might get $200 per sign up or $300 per sign up or $150, $100 kicker for everybody over 20 that you sign up in a calendar month. All those different things, those are broker tools, right, to incentivize your behavior. Okay, so CMS says you get paid $605 per selling Medicare new enrollment. That's what you're going to get, right? From because we're not paying you, the carrier's paying you. Okay, so we contract you with the carrier. Okay. On the Medicare supplement side, it's set up somewhat similar to the life insurance, where the top commission might be 21 or 22 or 23%, something like that. And so there's a couple layers in there for hierarchy. And then, street commission might be 18, 19%, 20%. Some, let's say if you're super street with a carrier, right? We start all brand new agents out at 15%. Most agencies start out at 11, 12, 13. So we're already higher than most. And then you can earn your way up based on your production. Okay. So that's how we have it set up. Okay, Patrika. But if you're coming from somewhere else, then you already have an existing comp rate. So just look at the comp rate and say, okay, well, am I going to benefit from coming over? In some cases, I know we're improving people's contracts just without any modifications at all, right? But if let's say you're a monster producer and you've got a GA or SGA level whatever the thing is from wherever you're coming from, right? We're obviously not going to make your situation worse. So if you've already got the documented production and somebody else, you've gotten the carrier to give you a certain commission rate, then the carrier will honor that when we move your hierarchy. So nobody's commission is ever going to get cut. If that answers your. And Skylar, go ahead. Yeah.
Yeah. So one thing about that, as far as moving over, there are some carriers that will not allow you to go up with the move. You have to be at that level beforehand. So we can't entice somebody with a higher level contract necessarily than what they're at right now. A couple of carriers you can do that with, but there's a few that will not let that happen. And I know we talk about United Healthcare. That's one of them that won't let you go up in contract just to move. So, so like Eric was saying, it's really about where you're sitting at right now. We'll look at that, and as production goes up, we'll have another discussion about it later. So.
Okay, sounds good. And with the because I know like healthcare is a little different from the life insurance. When you say the 50%, the street level for the supplement healthcare, right, or health insurance, is that like all of it, like for all 12 months, or is it like the first 9 months advance and then?
Yeah, good question. So the way Medicare supplement works, which is so cool, is that it's a constant commission rate. Okay, so let's say you're at a 15% for easy math. Okay, and you sign up somebody and it's $200 a month. Okay, again for easy math, so $2,400 a year, right? 15% of that would be for $360, right? So, so you would get an advance, a 9-month advance on that $360, same way you do with your life insurance, right? And then you would be on earnings month 10, 11, and 12. And then when it goes into month 13, you still get 15%, which is awesome. So 360 a year is $30 a month, right? So basically every month that client is on the books, right, for the next 6 years, you're going to get your $30, right? So if you signed up, 100 people even over the course of the year, which is like 2 people a week, like it's hardly anything, right? If you just have your antenna up and add 2 Medicare supplement clients a week, that's 100 a year. That's $3,000 a month in residual income going into year 2, right? If you do that for 5 years, right? Which, I mean, I don't know anybody that's wanting to retire in the next 5 years. So like, I mean, you do that just again, 2 a week, right? Over the next 5 years, you're going to have $15,000 a month of residual income coming in from your Medicare sales.
You do have to account for the people that come off and the people that get flipped.
Yes, correct. Yep, I don't have a regression analysis done, but yes, you're correct.
I can give you some rough numbers on that. Okay.
Go for it.
From a marketing standpoint, that's what I went to college for, so on and so forth. That's where I started my career at. But from a marketing standpoint, you're going to have about a 15% turnover rate if you're good at your job. Okay. You need to accept that about 15% will pass away, will move. Joe Namath will snap them up from a TV commercial. Something is going to happen to about 15% of those folks, right? However, once we get past 15%, if we get to 18, 20, 25% loss rate, this is on the agent at that point. The agent's not doing their job. So yeah, there's going to be some churn automatically in this business, and you have to accept that, just like with life insurance, right? But as long as you understand what those numbers are and what's acceptable and what's not, you can be extremely successful at this business and build a huge residual income.
Absolutely, sounds great.
All right, guys. Well, hey, listen, I've taken it up to 11:03. I hate going overtime, so let's call it. We'll be back on here same time, same channel next week. I will not be talking all the time, so if that's an enticement for you to come back so you can hear somebody else talk, we have one of these experts lead the next call on a particular product segment. So anyway, thank you all for being here. Respect your time, and let's make some money together and help some people. Cheers.
Have a great day, everybody. Thanks, Eric.
Have a good one, guys.
Hey, Eric, can I